Welcome to the Dean's List, engaging conversations at the intersection of entrepreneurship, artistic expression, and holistic health. Experience wellness in full color, where fashion, beauty, and art blend with body, mind, and soul. Embark on a journey that dresses your aspirations in style, paints your life with beauty, and sculpts your well-being in every dimension. This is the Dean's List, where inspiration is always in session. Welcome to the Dean's List, where we are navigating the intricate interplay of holistic health, artistic brilliance, and entrepreneurial vision. I'm your host, Allison Dean, and today on the Dean's List, join us for a lively session with Michelle Phillips, a dynamic myofunctional therapist who's not just treating symptoms, but is literally changing the way people breathe and speak. With a degree in dental hygiene and a passion for the power of the tongue, Michelle dives deep into the roots of oral health, proving that sometimes the solution is right under your nose, or even better, behind your lips. Tune in as she unravels the secrets to optimal oral posture and shares why good health might just start with a good tongue position. Hi, Michelle.
Well, hello. So good to see you.
So good to see you too. All right, so we're going to jump in. I want you to take us through your journey. You graduated with a degree in dental hygiene, and now you've transitioned to becoming a specialized orofacial myologist. So, talk to us about that transition.
Okay. It was quite the journey for me. I've been a hygienist now for, it'd be close to 30 years. So I have years under my belt. And I want to say it was back in 2016 where I was working I usually worked 4 days a week as a hygienist. And I just had constant neck pain and headaches. I was at hygienist and I was always rubbing my neck and doing this. And I just thought it came with the job. Honestly, I thought it was just, it is what it is. This is what happens when you're a hygienist. And, I went and saw various providers. I mean, I was seeing chiropractors, massage therapists, you name it, I was there. And just so I could survive, taking, Advil like it was a vitamin. And it was always just there. And so I was getting frustrated and was thinking, I might have to change my career. I might have to do something totally different. So I don't know if you know who Dr. Mercola is, Joseph Mercola. Yep. He's an osteopath, just a brilliant man. And I was listening to one of his podcasts and he was interviewing a hygienist by the name of Joy Muller. And she is amazing. She's one of the trailblazers for the field of orofacial myology. And she was talking about, tongue posture and breathing and, malocclusions and all these things that can affect your face, your jaw, and just by improper muscle function. And I was like, this is really fascinating. I didn't learn any of this in hygiene school. So I just went down this rabbit hole and I'm like, I just want to know more, sign me up. I ended up taking her course and it's called the AOMT. It's one of the organizations to learn myofunctional therapy. So I went and took her course down in San Francisco and was just blown away. Oh my gosh. All this knowledge I had, and I was so excited to get back and, implement all this into the office I was at. And of course, you get that resistance, from dentists or, just it's new. Right. But I was at that time, I was working for a female dentist and she was kind enough to let me stay after hours and see a couple patients, a few clients, which is really cool. So that's how I started. But the more I kept learning and taking more classes and really diving into this field of orofacial myology, I had a problem, huge problem. So now it's okay, it's kind of become my personal journey. Yeah. And I wasn't seeing a ton of clients, but I kept doing the exercises and trying to educate myself. And I was an absolute mess. So, and that's we'll talk about my mess here in a few, but so 2016, did all the courses through 2017, 2018. Well, then COVID happened, right? The pandemic happened. So I didn't really see a lot of clients. I had actually changed to another dental office and I was very content there. Mm-hmm. And I noticed that the more I was working, my neck was a lot better. I was like, this is, with the exercises and whatnot, but still I wasn't 100%. So then I actually went ahead and did a tongue tie release. Mm-hmm. And it was life-changing for me. And this is just my own personal experience. Everyone has their own, story. Yeah. But it was like, oh my gosh, I can turn my head. I can turn, it just felt so much better for me.
Right.
So, I actually started seeing more clients in the last year.
Okay.
So I was finally able to transition from full-time dental hygienist to now I just do it one day a week. And only because I really want to, I still love dental hygiene, but I want to be able to clean my kids' teeth, my husband, my parents, friends. So, I like to be in that environment. It's comfortable for me, but I love the challenge of myofunctional therapy. I have my own business called MyOMT of Idaho, and I lease space from a good friend of ours. He's an insurance agent. Yeah. So he owns an insurance building. And so he was kind enough to let me lease a room in his office, and it works out really great. So yeah, I'm really enjoying it.
It all falls into place.
It all fell into place.
I love that. Okay. Yeah. So I think there's probably many people that don't quite understand what orofacial myofunctional therapy is. So can you kind of, for all the people out there that are going, what are you even talking about right now? Share a little bit about it. And obviously it impacted your health, but just, I think all the ways this therapy is significant for someone's health.
Okay. So basically it's neuromuscular re-education of the orofacial complex. So I like to compare it to, so I'm a tennis player. I played tennis my whole life. So, I have, my forehand, backhand, I'm all set at 12 years old, and my coach decides to change the grip on my racket. And now I'm hitting differently and it feels weird and I don't like it. But I keep practicing and I do it over and over. And that's what we call it muscle memory. Mm-hmm. So that's basically the same thing. It's muscle memory. We want our brain and the muscles of our tongue, our lips, everything to be working, together in harmony. Mm-hmm. So it's physical therapy here on up. Mm-hmm. Yep. Mm-hmm. This whole area. Mm-hmm. So doing the, exercises for not only the tongue, but also for, the cheeks, the masseters, the buccinators, all of these muscles here. But a lot, with the tongue. Yeah.
Yeah. And so
the tongue's amazing.
The tongue is very powerful. And so where does this therapy, where can it affect someone's health? For you were experiencing tension in the neck and your shoulders. Obviously it led to you doing a tongue tie release, but what other things present that you've seen where people that have come to see you, it really has affected elements of their overall health?
Let me talk a little bit about, so there's 4 goals for myofunctional therapy.
Okay.
So the first one that's the most important is nasal breathing. So we need to be able to breathe through our nose. If we can't breathe through our nose, we need to figure out what the heck's going on. Is it a structural issue? So that is the number one thing, because if you're a mouth breather, things, and actually that's what I was. I was a mouth breather. I had to retrain my whole facial muscles. So as a hygienist, had my mask on and my mouth is open. My mouth is open because for me, and like I said, everyone's different, but my tongue was tethered. And so it was easier for me to just kind of keep it open. Just like that. It was parted a little. And so what that does, the tongue is attached to the hyoid bone, which is connected to, the sternocleidomastoid, what we call it. They're all connected.
Yeah.
And so you're putting strain, on those muscles, and there's just so much dysfunction. So mouth breathers are a big one. Okay. Let's see, tongue thrust. And that's, again, I all of this. So as a baby, I was born in the 70s. Mom's never really nursed, right? So I was bottle fed, and I had the worst. I mean, I was a thruster. My brother would make fun of me when I would drink, because you could just see my chin, like it was. So a lot of that tongue thrusting was going on. But tongue thrusting is more, it's a symptom of something else going on. It's an airway issue. I'm trying to figure out how to breathe. And so tongue thrust is another one. Orthodontic support, people that were in braces forever, got those off, lost a retainer, which was me also. And then your teeth are crooked again. And it's like, well, what happened? So myofunctional therapy is great because, the lips should be the actual retainer. It keeps everything in check. And the tongue should live in the roof of your mouth, which is the next goal for myofunctional therapy, is tongue to spot, is what we call it. It's behind those two front teeth, not touching it, but not only just the tongue tip, but that whole tongue. We want that whole tongue to be resting on the roof of your mouth. So that's the second, is get that tongue up. The third goal is lip seal. We want to make sure lips are always sealed. So we're, again, breathing through a nose. Lips sealed. And then the fourth is proper swallowing. Want to make sure that tongue's on spot, and it's just like this nice wave when you swallow.
So many things
Which
to
I
think
had
about.
oh my gosh. So, I had to retrain, just everything. So my journey, it took me a while to actually really feel, comfortable and confident as a myofunctional therapist. Because I was going through all of it myself. So it's a lot.
But I think it's almost perhaps more invaluable that you were living it yourself as you were building your business, because you could truly reflect back all of the positive impact that things were having. So it's like there's a different level of, I think, energy around something when you yourself are experiencing the benefits of what you're trying to offer to other people. It's like it's
because getting your tongue revised, well, and I had to have it done twice, but it's painful. I mean, it's not, and so I can empathize with clients when they have their procedure done. I know, what to expect, and and how important those exercises are before you have your tongue released. It is so important to have the exercises, or go through my functional therapist who knows
what they're doing,
how to do it. And then afterwards is crucial too, because it's like I always say, it's like your shoes are tied together. And that's kind of how I was walking, many years of my life. And then when it was released, it was like, holy smokes.
Yeah, you felt the difference.
And speech and that's another thing too. I was also in speech therapy when I was young.
Interesting.
So, and now it just feels different. I didn't even know what my soft palate felt like. Like I was like, oh, it feels like this squishy, I don't know, it feels like an orange, or it just feels odd. I never knew what that felt like until, but 6 years ago, I think, is when I had it done.
Yeah. So. Okay, so a couple things. I did not think tongue tie release was painful. So maybe that's a credit to who I saw or whatever. But not so. Just to give people, the listeners out there, if you have to do it, I didn't think it was painful. I actually thought the scariest part was just when they numbed me. Like I thought that was going to be, and that wasn't that bad either. It was more in my head than anything else. Tell us some of the signs, symptoms, something that would indicate that someone is like a candidate to come see you. And then is there a target age that a parent should be mindful of, or, from your experience?
So target age, I think myofunctional therapy starts from infancy. You know, I would love for moms to be able to nurse for, 1 to 2 years, because that is just the best myofunctional therapy. That tongue is up in the roof of their mouth, and it's just providing that nice growth and development. And that's the best. As far as what I'm looking for, a lot is posture, even, someone with that forward head posture, just that longer face, the bags under the eyes, just that open mouth or open jaw,
right.
That the mouth is hanging low. As a dental hygienist, we can discuss this later too, but there's so many things that hygienists can pick up in their chair.
Right.
When you're doing an oral cancer check, you're already looking in their mouth, and you can check to see, what is their Mallampati score like? What does their airway look like? What do their tonsils look like? Is there some scalloping that's happening, on the sides of their tongue, meaning that there's not a lot of room in their palate. So there's all these other, little abfractions is what we call it, where it's worn down on the, by the very tooth and gum area.
Yeah.
That's a sign that someone might be clenching or grinding. And that's, that can be a sign of a sleep disordered breathing issue. So there's all these little signs to look for. And I would love, actually, if there's a hygienist in every dental office, that would be amazing.
Yeah, because it is very...
a myofunctional therapist, excuse me.
Yeah. In every, someone that can really hone in on that. Yeah, I agree.
Because it is an epidemic.
I was just going to bring that up. It seems, and I don't know where this is popped into just my Instagram feed or what have you, but it really does seem like there's a lot more mouth breathing that's happening everywhere, and it's really affecting. It's why you see so much about there's all these weird products that exist now, right, where people can do things to strengthen their jaw or whatever it is to create that chiseled face or whatever it is. But a lot of it just comes down to, are you doing those few things that you just said? Are you breathing through your nose? Lip sealed? Is your tongue up? All these, are you swallowing correctly? I think just that core set of things that evade so many people, and just starting there is so hard for people to even teach themselves. So
with the mouth breathers, you really, and I was a mouth breather, is to retrain yourself to breathe through nose. And right now I'm actually taking, I want to become certified in Buteyko breathing. So I've been working on that. I love the philosophy is that low, slow breathing. We don't need to take so much, so much air in. Just that nice, low, slow, calm breathing, tongue on spot that gets that, parasympathetic nervous system kicked in, which is that rest and digest, and everything's just nice and calm.
Yes.
That's why babies will suck their thumb. They're actually pushing on that, our magic spot, and just kind of soothing themselves, So just very interesting. And actually, as far as when I like to see clients, this, 4 or 5 years old is great.
Okay.
That's a perfect age, especially with the 4-year-olds kind of pushing it. But if they can, follow directions, and they're mature enough to do the exercises, then that works. But cranial growth development actually stops. Well, it's 60% is completed at age 4. I want to say, and 80, I want to get this wrong. 80% is completed by age 9 and 12. So there's so much movement and things going on that if we can retrain those muscles and have them working, the way they should, then that child is set up for success. And, we avoid the TMJ issues and the, headaches, neck aches, and sleep apnea. Airway is huge. So yes, I reflect on everything that you're saying right now and just go, yes, I just wish it was a little bit more
obvious in the 80s when my mom, it's funny though, because my mom worked for dentists. So she was very, in that universe of things. And yet, she just didn't have that same focus on, I think, tongue posture, what the impacts of improper tongue posture can do to a child. And so, of course, I had the braces, I had Invisalign as an adult. So, and of course, it's what drew me to see you, because I was going, why am I a mouth breather? Like, I know I was a mouth breather, right? And so it was one of those things where I knew I needed someone to help me fix that or just, at least kick me in the butt a little bit of what I needed to do, even though I am really like not an ideal student in this capacity. But, but
you're pretty compliant.
I think it's like just having the awareness really is the first step to knowing that, there are things that you can do. And I think
awareness is huge. Yes.
Awareness is huge, right? Like like so many people just need to be aware that this is something that could be affecting how they're feeling and their overall health. So, I think there's something to be said for that.
Right.
Okay. So you've kind of already mentioned one of the organizations. You've trained with both the AOMT and the IAOM.
I know. It was very confusing. It was a very confusing time in my life. Trust me.
Which one is it? Yeah. Okay. Yeah. But so training with these very prominent organizations, what have those experiences done to influence your approach and your overall, I guess, the style of what you do in your therapy practice?
Yeah. So the AOMT, like I said, it was Joy Moeller. She's the hygienist. And very in-depth course. And I felt like they focused a lot on airway, which was fascinating, and sleep disordered breathing and how improper, function of the muscles can affect snoring, sleep apnea. As far as that, so I'm going to clarify one thing. So I actually took a course through the Neo Health Science. She was affiliated with the IOM. It's like there's so much political stuff that happens in this field. So, but she kind of branched off and did her own.
Oh,
right.
Okay.
So it's actually with the Neo Health Service.
Okay.
I want to say.
Okay.
But she was affiliated with the IOM. Okay. But anyway, that course was amazing. It was more hands-on, like, how you treat clients and different clients, and exercises that are given for specific issues. Right. And it was more hands-on. I think learning from both is helpful. And I think, there's so many other instructors, and everyone they have so much to offer, and, you can't go wrong. But I really enjoyed both courses. Yeah. And I continue. I mean, the orofacial myology world is ever changing. There's always new research coming out. Things are changing, different protocols. So it's just, you got to be able to stay on top of it and be ready to, to change your protocol.
Right.
So
yeah, it makes sense. I mean, that does make sense. Okay. So you've talked a little bit about different treatment processes, but can you describe maybe a typical one? And I guess depending on what the issue is, what could a treatment look like for a specific kind of an issue?
Okay. So I see quite a few that need a tongue tie release. So, and it's via teletherapy. So that's a little different approach. I'm going to give you an example of someone that comes to my office, found me on Google.
Okay.
Mouth breather, just wants to be better at, proper lip seal. They learned a little bit on Google. As soon as they walk in, we do a complete health assessment, talking about from infancy, like what was it like, when they were born, and were they breastfed, and, did they walk, talk, and crawl at that right age? what is your diet like? Diet is huge. You know, do they like soft foods, hard foods? Are they picky eaters? You know, I think I mentioned, what's their posture like?
Yeah.
I look in their mouth, of course, as a dental hygienist too. I mean, is there a lot of like fillings? Is there a lot of cavities, recession? Is there scalloping of their tongue? What does the back of their throat look like? We do measurements for range of motion, you know, the tongue range of motion. What is their, like horizontal, vertical, like, can they do these, you know, do the little dance with their tongue? Can they do a taco tongue? Can they do, you know, a lot of people say, I can't do a taco tongue, but then after therapy, it's like, oh my gosh, I can. Look. So you can learn a taco tongue. We do photos. Photos. I want to know what their bite is like, what classification of occlusion they are.
Yeah.
Is there an overbite, deep bite, gummy smell? Then I, you know, look in their mouth as far as, are they tied? Is it tight? What does it feel like? You know, is it more of where it's really tight in the front, or is it tied away in the back?
Yeah.
Call it a posterior or submucosal tie where it's just so tight back there. What is the measurement of their palate, you know, from first molar to the opposite side?
Yeah.
We want that to be nice and wide, because the tongue, that's another thing too. I mean, if you're going to release your tongue, there better be room up in the roof of your mouth, because if there isn't, it can go back and you could have some sleep issues. So I want to make sure that palate is nice and wide. We do photos. I watch them swallow. How are they drinking? Do they have a tongue thrust? Do they pouch their liquid? There's a lot of people that will put water and just kind of drink that way. A lot of interesting things that I see. Food, eating, you know, how are they chewing? Do they just chew on one side? Do they chew on both sides? Do they open, you know, are they chewing so fast where it's just crumbly looking? And, you know, because that's not good, because you're swallowing air, you know, and then, you know, do you have gas? Do you have, you know, hiccups, burping? I mean, so it just is amazing how just some of these signs, you know, you just connect the dots, and it can lead to other health issues. Possibly. I shouldn't say possibly. Yeah.
Okay. So lots of assessment, and then
a lot of assessment.
Then what does like typical treatment look like?
Okay. So then we formulate a treatment plan. Everyone's different. So in my clinic, it's very customized. Like, you know, depending on the person's age, the person's, you know, how compliant are they going to be? I really like to do it, you know, a good first 8 weeks, once a week. See me for, you know, a half an hour, and we go through, you know, lingual skills, trying to get that tongue stronger. A lot of them are really, really shaky. They can't quite do all these lingual skills, is what we call it. So we start slow and start building on that, teaching them tongue tip to spot. Where is spot? You know, and I use like rubber bands or holding, you know, a raisin or something up in there.
Yeah.
And let's see here. So first 8 weeks, and then we start to spread that out. And I'll also evaluate too, like, you know, does this person even have a tongue tie? I never like to send someone out to have it released right away, because a lot of times those numbers change. So when I'm doing the measurements, which, you know, like how wide can you open with your tongue to spot, or bring that whole tongue up, those numbers change. I've seen it all the time where we're stretching out that fascia, we're working that muscle. Yeah. And it's like, oh my gosh, like, yeah, I can, you know, you may not need a release after all of that. So I evaluate that at 8 weeks. And then we start working on the suctioning and getting, you know, getting those cheeks nice and strong, and understanding how to form that bolus, and swallowing liquids first. And yeah, so, and at the end, it's more of, you know, habituation. Like, the goal is, if you can do this in the day, hopefully you're doing this at night, and that's the goal. Right. So until that client it's habitual for them, like, and their symptoms are gone. They're not, you know, they notice they're not mouth breathing. They don't have any issues. They're functioning well. Then, you know, I never, people will always say, okay, you know, 10 sessions or whatever many, 12 sessions, and then you're done.
No.
Yeah.
I
don't know. It's like, I feel like it's a journey because it's like you're working out in the gym, right? It's not like, okay, I'm getting all these exercises done, I'm good.
Right.
I think checking in, so as a hygienist, I'm used to like seeing patients like every 3 months, 4 months, 6 months, once a year. And I think just checking in on them to make sure, are you still doing okay? Are your muscles, working? Are they functioning right? Then I think that's good to check in with the client.
Yeah, I think so too. I mean, unless you're just an A student, which I can't say that I was an A student in this capacity, but I'd like to think I was an A student in other capacities. Okay, so like if someone, let's say, they don't have a budget to come see someone like you, but they know that they have a problem, is there like one thing someone can start with, if anything, to help get them on the right path? If there was just something that they can do at home.
I would say that the most important thing is nasal breathing. So blow your nose. I mean, I know this sounds crazy, but as far as like kids, I mean, I have parents saying, yeah, he hates to blow his nose. She's so-and-so scared to blow her nose. And just cleaning that nasal hygiene is so important.
Oh yeah.
Just blowing your nose. I really like that clear nasal spray. It's XLEAR, it's xylitol, it's natural. And it just helps kill the viruses, in your nasal passages. Using like a neti pot, or I use just a saline rinse, and just getting all that junk out is so helpful.
Yes.
And even using like aromatherapy. Doesn't have to be doTERRA. It could be whatever floats your boat. There's also those boom booms, little sticks that you just put up your nose and you just inhale it. But just the thought of, okay, it's that mentholatum, like when you're a kid and you had that, your mom used to rub it on your chest. Yeah. Just smelling that and just being aware, like, okay, I can breathe through my nose. Okay. And just focusing on that nasal breathing is super important. And then, that spot right behind your two front teeth, there's a little ridge there, and just getting that tongue, just thinking about your tongue tip up there and really working on not clenching your teeth. You need to have a little, we call it freeway space, where it's a little 1 to 2 millimeter freeway space, and just posture too. I mean, so just things that, it sounds really easy,
but it's not.
No,
you have to be so just like focused. Like you really have to be so aware of your body
all the time.
Unless it's like, I don't know, ingrained in you from such an early age. And this is where, as parents, you really can benefit your child if you're if you're very observant of what's going on. You can do your best to try and, steer your kiddos in the right direction so that they don't have to suffer the way that we do.
And that's, and that's my goal. I mean, I suffered a lot, honestly.
I relate to you so much, Michelle. Yeah.
I think it's the generation. I mean,
God,
I was fortunate enough though, because back in the early 80s, orthodontists were into pulling out those premolars, those first premolars.
Yeah.
And that is just not a good idea.
Pulling teeth should never be.
I kind of was doing my own research. So when I was cleaning people's teeth, the patients that are missing those premolars, everyone I asked, I said, do you snore? Do you have a sleep issue? Oh yeah. Majority of them snore, have a CPAP. It's because your maxilla is so narrow, and that is the floor of the nasal cavity.
It all connects.
So it's all connected. So you want that wide, you want everything wide and broad. But society, look at the models, right? We're always, they have their little lips apart like this, and, that's attractive. And instead of that, resting bitch face. Right? I mean, that should be the norm, is just, yeah. Yeah.
Oh, the more you know, the more you know. Okay. So I love it. This is like, I hope everyone is benefiting so much from this right now, because these are very simple, like, tidbits, but they're not so simple unless you really start to embody and leverage and do them.
Awareness
Is key.
Yeah.
Okay, so transitioning into a specialized field like this, it must have presented some unique challenges. Anytime you start a new business or something new, there can be some challenges. So were there any like initial obstacles that you faced when you were beginning to establish your practice, and how did you overcome them?
Yeah. Well, I am fortunate enough. I am married to my very best friend, and he's probably the smartest businessman I've ever met. So he helped start the LLC. He helped, and he guided me in the right direction. I wanted to quit my day job, honestly, quicker. I wanted for my dream job. And he's like, no, you can't do that yet. You have to build this slowly, and you got to, build up the clientele, and then we can talk about, the next step. Challenges, getting the word out. I mean, because, but it was during the pandemic when I was kind of wanting to do more, and, getting other healthcare providers understanding the importance of myofunctional therapy and how it can benefit, like, especially with like the orthodontist, I can, definitely be helpful with their cases, and, helping them understand that, myofunctional disorders can really affect the growth and development of these kiddos. So those were some of the obstacles, trying to figure out where I was going to start my practice, but like I said, I was fortunate enough that I got offered to work in an insurance office, and it works fabulous for me. So so the overhead's low.
Right.
I'm just a one-man show. I don't, maybe I'll have a partner someday, but right now I love just being by myself, honestly, because I can set my hours, and I can spend as much time as I can with my clients, and which I love, and be my own boss, which is so different from dental hygiene, and it's a different mindset, because for almost 30 years working with dentists.
How was that for you? Like, so in terms of the transition to becoming your own boss, but then also still having a boss in your other life, what was that like for you?
That's kind of why I had to go down to one day, because once I learned so much about myofunctional therapy, it was very hard for me to have my dental hygiene hat on, and then and then have my myo hat on. And so when I'm seeing a patient, I'm looking at their gums, I'm looking at, I'm seeing things differently, I guess, and, especially with the mouth breathers, you see that just bleedy, dry, just those gums are just flaming red. And, you just want to ask more. And, how's your sleep? How's your breathing? How's your, I can help you. But it was really, it was hard. Honestly, I was very fortunate to have good bosses. But it was just hard for me to keep taking this hat off and putting that hat on. And,
right.
So, and it's funny because it takes a while for dentists, I feel like, to get into this airway and myofunctional issues, so that's a challenge for me. I mean, just they need to look at that. I think it's they're seeing patients every 6 months, and we have an opportunity to help a lot of people with airway issues. So hopefully more and more offices will have a screening tool, which the American Dental Association recommends that all dental offices should have, should be screening for sleep disordered breathing. So hoping more offices will do that, and then, referring them to the right providers. So, and that's another part of myofunctional therapy is I'm kind of steering people in the right direction. I'm not the end all be all. I can help you with your muscles, but if there is an airway issue, then I'm going to send you, to the appropriate providers. So whether it be ENT, getting a sleep study done, we need to get some, the diagnostics taken care of.
Yeah, I think some of that is rooted in just what the education path looks like in dentistry and in orthodontia. So much of, you see this with medical providers too.
Oh, yeah.
Unless you're following
a certain guideline.
Whoever is deciding whatever that curriculum is. And if it's not a part of the curriculum, then it's not a thing. And it's like, well,
there's more.
Right.
It's like functional medicine, right? I mean, just you want to get to that root cause of the problem. I think that's just so, and I just had a hard time looking at a person's mouth, like they need a crown. Okay. But why do they need a crown? It's like, because, and most people will have cavities on those first molars.
Right.
But some people can't, and I couldn't. My tongue could not reach to clean, and the tongue is used to clean your mouth.
Oh.
And if you can't reach that first molar, chances are you're probably going to have a cavity at some point. I mean, because the tongue should be able to clean. Or if you see, I was this too, that kid that would stick my finger in my mouth and scoop food out.
Yeah, right. So many people do this.
I did all that too. So I see things a lot differently.
Yes, you do. Yeah. That's powerful.
Yeah.
Okay, so you kind of talked about this a little bit. You teed me up for this, but so I want to know more. Let's talk more about how myofunctional therapy integrates with dentistry, with orthodontia. Just elaborate more. I think also on just some of the relationships that you've built with key providers in those different spaces. And I think it's important to call out certain people that may be more turned on to the importance of, finding someone like you and really the partnership between your work and their work. I mean, I think it's important to call out some of those doctors that are coming forward more because, it's not so known, I think, to people. So anyway, talk a little bit about that. I know you're a part of a group here where there's some dentists and you, and I think that's interesting. I don't remember the name of it, but you'll tell us.
I will tell you. So there's a couple providers here that do the ALF appliances so ALF is accelerated light force. It's a wire basically. It reminds me of a paper clip that you're placed in the inside of your upper arch, and it just provides this light pressure. And so it doesn't necessarily expand, but it's providing this nice, healthy, bony growth.
Okay.
So there's a couple providers here. I'm sure everyone, familiar with Boise Integrative Dentistry with Dan Bruce is one. And another one is Dr. Gerard. So he's been doing more alpha. So which is great that there's more providers out there.
Yeah.
Airway orthodontist is someone that I like to recommend. I work with one in Northern Idaho, Dr. Christensen, who actually he's been expanding like his granddaughter's teeth when she was 4 years old with an appliance that he created himself.
Wow.
I can't remember what the appliance is called, but anyway, he does Schwartz appliance too. So I see beautiful, beautiful results with the things that he's done.
Okay.
He can widen that palate like no other. So
wow.
I really, really admire his work.
Yeah.
And there's a few, there's some here in the Treasure Valley that are slowly understanding the importance, but it's hard because it's, most of them are traditional. They just want to straighten teeth, and I know.
And there's so much more.
There's so much more. And I think it's just education, getting the word out there.
It's education if someone is open to the education, because I
Correct.
think you have to have a curiosity for what else is possible. And I think there are some providers that have that curiosity, but I think there are also many that just want to stick with what's been in the textbook. Yeah. Right.
Absolutely.
Yeah.
Absolutely.
Which, you have to find what you like, but I tend to find I like the ones that are more curious.
Me too. And I love like Functional Medicine of Idaho.
Yeah.
They get it too. They get myofunctional therapy.
Right.
Which is so nice to see, because they're seeing the whole body, right? I mean, this is just I say this is a gateway to the mouth is a gateway to everything. Everything. Yeah. And so functional medicine, they get it. And they ask a lot of dental questions with their patients, and obviously sleep questions. So yeah.
Well, I think it's interesting too, how it all kind of starts with the mouth, and how much the mouth is tied to the gut, like just the connection between wellness with your gut and your mouth, and
it's all connected.
The health of your teeth. I mean, you really want to keep the teeth healthy because of all the different nerves and everything. Your teeth are connected to so many
important.
Oh my gosh. And I feel like that's also not emphasized enough in life. I mean, for so many, unless unless something happens to you where suddenly you then start going down the path of education, I think it should be happening much sooner. People really need to, Dr. Seuss did have the tooth book, which is actually pretty clear, where he says, once you get your second set of teeth, that's it.
That's it.
I'm like, well, Dr. Seuss, you are correct.
You say, just floss the ones you want to keep.
I mean, truly. Okay. So I want to hear, go on.
Well, I was going to say, so in the dental world, as far as mouth breathing, I mean, it dries your whole mouth out, and it can lead to decay.
Right.
You need that saliva. You need that cleansing. So the dry mouth can cause decay. Xerostomia is dry mouth. And then you're on all these different kinds of products. And it's like, let's just close our mouth and, maybe trying some mouth tape. And that's another conversation we can have too. But
for me, I did the tongue tie release, which was fine. I don't know that it didn't, there was not a significant shift for me, which is okay, because I didn't really have an expectation. I was more curious to see if I would have some kind of a response to it, but I don't know that I was expecting anything more than, let's see what happens. But I do think, and I've seen Dr. Gerard, he's measured my palate to see if I needed it to be widened. I'm sort of at that cusp where it's not significant enough. Like, I'm within all the ranges where, it's one of those, well, you could do it, but are you really going to have that much of an impact? I don't know. So like sort of risk reward, it's so unclear in that aspect of like going back into orthodontia and doing like a big expansion and what that actually could do. It's certainly very much on my mind still. Like, I'm still very curious, because now, of course, I'm seeing so many more things in my Instagram feed all the time about people doing expansion. And I'm like, oh. But, I think there's also not many obvious orthodontists that are very comfortable with an adult like me who has been through orthodontics twice. And, again, the risk reward for them too, I might be a riskier person to even take on, because the impact could be significant, or it could be like nothing, and perhaps something really terrible could happen. Who knows? So it's like, it's an interesting kind of conundrum to exist in for myself right now, of like, how much more can I do to benefit, proper facial structure and, making sure that I am breathing correctly and doing what I can for my health, in finding perhaps an orthodontist that really understands things. And I think that's hard to find.
They are hard to find, and there's like a handful of them. I mean, I know there's one that's really good in Colorado Springs. I mean, you have to travel,
right.
California. So, but you have to look at how are you functioning? I mean, what are your issues? So, do you feel like you're functioning at full capacity? Do you feel like, I think you look great.
I just wanted you to tell me I looked great, Michelle.
You're beautiful. And are you sleeping well? I mean,
I have a 4-year-old, so there's
right.
Like
but are you breathing majority through your nose?
I think so.
Your mouth is closed, your jaw's closed, your tongue's up.
I went to go see Dr. Smith in Dr. Gerard's office, and he did a bunch of like jaw testing things. I feel like I want him to send you like whatever the outcome. This was probably, I mean, I don't want to say it was a year ago, but it was definitely a while ago.
Do you have TMJ issues?
No, I mean, no.
Are you trying to find a problem, Allison?
Well, no, I just know that like even when he did all those like bite, I don't remember what the test was called, but like, he tested like every element of my bite, and it was there were issues that he saw. He was like, oh, it's like very significant here, but not so significant here. And so there was obviously things going on within my bite where there's tension happening, which, I've been told by, facialists, like, oh, Allison, you're really tight, in your jaw, or, you're tight here or whatever. And so we know that those things are being affected because of how I'm chewing or the bite occlusion. Yes.
Correct.
And so I don't know that I'm certainly not trying to find things, but it's more of just, I'm observing, how can I help myself when it's not necessarily so straightforward, unless I perhaps do something more significant with my whole jaw,
Right. And do you want to go that route too? Right.
Yeah.
Same with me. So, I had my tongue released. I feel so much better. I do myo. I do all of that.
Yeah.
Am I 100%? I'm probably 80%.
Okay.
But, I could expand my palate, and I've been talking, about possibly doing that. But I mean, do I really want to go through all of that right now in this stage of my life? I don't,
I feel you.
I'm this is not good, but I'm the healthiest I've been.
Yeah.
I feel good. I don't get headaches like I used to. I don't get migraines.
Yeah.
I feel good.
Yeah. Well, take it. Okay.
I'm going to take it for what it's worth. Yeah.
Besides your own impactful case, like, is there like a particularly memorable person that has come to see you where you can just totally tell that the work that you did together really affected that person's quality of life?
Two people come in mind, and there are women in their 40s, actually.
Okay.
I love women in their 40s because they come to me and they usually are in pain.
Yeah.
You're at that point where, with hormones, and you're, now you're thinking about yourself, your kids are grown, and now you have these TMJ issues, and you're not sleeping well. And I would say those two sticks out in my mind, where they feel so much better. They don't have, and one of them did not get her tongue released, but just getting those muscles working properly, it's life-changing. And, it settles the TMJ joints. The headaches, for one, disappeared, and she's sleeping so much better. But could she expand? Probably. But again, do we want to go that route? So there's so many cases where parents will tell me about their kids. So when they first come to see me, we do that complete health history, and they'll tell me, my kid is bedwetting, my kid doesn't sleep well, or is hyper, and all of these, my kid's mouth is open all the time. And then as this time goes by and I start reassessing, and we're going through the list, and they'll say, oh he doesn't bet. And they'll kind of look at me like I'm crazy. Like, no, his mouth is always closed. Like, they don't realize that how far their kid has gotten until you see the data.
Right.
But huge is when you're not bedwetting anymore.
That's significant.
Yeah. Or a lot of times I hear moms will say, well, now she feels more confident. She's raising her hand. She's speaking, because it affects the speech. I'm not a speech language pathologist, but just that proper tongue posture, it's giving kids the confidence that, they're talking in school. They're trying out for parts of a play. They're more confident. They're more self-esteem. And so that's huge.
It's a beautiful thing.
Yeah.
Are there any misconceptions that people may have about myofunctional therapy? Like, are there crazy things that you hear, or, things where you really have to like recalibrate someone because they ask you something and you're like, where did that come from? Anything like that? Yeah.
A lot of clients will think that, so if they're going to get their tongue released, that, okay, I just want some exercises a little before, a little after, and then we're done. And I'm like, no, that's, you're not done. Myofunctional therapy is a journey. Like, we're doing this, but now we have to do more. Sometimes it takes up to a year, not every single week, but to get that tongue and the muscles of the face and the brain working in harmony.
Yeah.
It takes time. So like quick one and done.
Not quick one and done with myo. Yeah.
No,
okay. That's good. Yeah.
Another, I'm trying to think. Some people think that I can fix everything, and I can't. Like, okay, I sleep. They'll say, I have problems with my sleep. Can you help me? Well, no, we're just a small piece of the puzzle,
right?
As my functional therapist. I mean, I work in collaboration with ENTs, the sleep doctors, your functional medicine. It could be, diet related, your general dentists. I mean, we all have to work together in collaboration, and sometimes that can get a little tricky. Just finding those providers, and because some people have their own through insurance too,
right?
And they'll say, I went and saw my provider, and they don't think I need a sleep study, and then so trying to get everybody on the same page, that can be
challenging,
tricky.
For sure. Okay, I think expectations should be minimal, because you want to go in with the hope that things will improve.
Mm-hmm, absolutely.
And if you do the work, likely things will improve, but you can't expect for magic to happen unless you put in the work.
Put in the work. And if you need to see another provider, like let's say a child has enlarged tonsils and adenoids, and no matter what we do, it's a structural issue, and you may have to have those out.
Specialists.
Not that I do work with a lot of holistic parents, and they want to maintain, which I totally respect, but there's times where it's like your kid can't breathe.
Right.
And, I did have one client where the little boy, he always felt like there was something stuck right here. Whenever he ate, he would have to have water, and he felt like something stuck. Well, he had huge adenoids, and now he's fine. He's sleeping great, and his mouth is closed, and it's like, okay. Yeah.
Well, sometimes it's
like a detective. We're trying to figure out, okay.
Yeah, definitely.
So that's the fun part about it. It's so different from dental hygiene. Dental hygiene just kind of gets a little monotonous, but myofunctional, I really have to think, and, I'm not a spring chicken, so it can get challenging.
It's like brain teasers all day.
Yeah. No, I enjoy it. I really do enjoy it.
No, it's good. Okay, so I want to know, what does wellness mean to you?
Oh, wellness. It includes everything for me, not just physical, which I play tennis. I try to walk my dog every day. I try to do some yoga. I need to be better about that.
Yeah.
But it's not just the physical, it's also, for me, it's spiritual too. So I'm a Catholic. And so I like to do my reading in the morning, and just kind of just meditate and just spend some quality time with God. So I like to do that. And as far as, let's see, wellness and education, just learning as much as I can about my field, staying on top of it, using my brain.
Yeah. Do you have any like wellness non-negotiables? So when you wake up in the morning, are there things that if you don't do certain things, your day is not quite as good as it could be?
Yeah, definitely waking up. If I don't have my hot water with lemon,
okay,
I have to have that.
Okay. Yep.
It's like my body craves it almost.
Yeah. Yeah. That's like your first thing. Yep.
Yep. And then prayer time, and then getting out and exercising. I'm kind of getting back into running a little bit. So doing that. I'm starting to play some tennis mid-week now. So it's been kind of fun, but just exercising every day.
I love that. Has your business influenced any of your views on wellness?
Yeah, because I'm just learning so much about everything and anything. I mean, TMJs and sleep apneas. And there's so much involved with this bit with oral facial myology that it makes me so much more self-aware and what I need to do. And, I feel like I said, I'm healthier now than I have been.
Yeah.
and I thank my business for it.
Yeah.
Just getting into this field.
Right.
And understanding just the connection of the muscles and, just the whole body, root cause.
Yeah.
And the fascia system from the tip of my tongue all the way down to my toes and just meeting so many neat providers. And I work with the really cool cranial sacral therapist who releases that fascia and helps me out too, personally, and also with my clients. But
love that.
Yeah.
Love it. Okay. So we're going to do a quick fire, and then we only have a couple questions left after that. So the objective is just say the first thing that comes to mind. Let it be easy breezy. Don't stress yourself out with the quick fire. Okay. First thing that comes to mind. Are you an early bird or a night owl?
Early bird.
Coffee or tea?
Coffee.
Favorite color?
Blue.
Okay. What was the first paying job that you've ever had?
Dental hygiene assistant.
Okay. Wow. It started real early. Okay. Favorite cuisine?
Japanese.
What country is your favorite that you've traveled to?
Japan or Peru.
Cool. That's I love that. It's very different, but I love that. What's the one app that you can't live without?
Oh, that's funny. Snapchat, because I love doing that with my kids. Isn't that weird?
I love that. What's the one word that you would use to describe your business journey?
Adventure.
Okay. If you could have any entrepreneur as a mentor for a day, who would it be?
It would be Joy Moeller.
Cool. Okay. Yeah, that's a great one. Is there a book that has significantly influenced your mindset, be it your business mindset or just personal mindset?
It's called, I have several, but one is The One Thing. Can't remember who it's by. The One Thing.
Look it up. Okay. The One Thing. I like that. Besides your own, what is another favorite small business?
I can't remember their name. Capri. She makes these fabulous soaps in Kuna.
Oh, okay.
Capri. Oh my gosh. Okay. No, this sounds really strange, but I bought this lavender soap.
Okay.
And I get eaten up alive every summer by no-see-ums or mosquitoes. And I swear, I don't know if it's a soap or what, but this is like the first year where I'm not getting eaten up alive.
Okay.
So kudos to this. I think it's Capri. I hope I'm saying it right.
Well,
but I know she's based in Kuna. She just started, and these soaps are made from like goat milk, and it's just fabulous.
Okay. Well, you can text me, and then I can add it into the episode description so people can find her too.
Okay.
We can guide people. If you could instantly acquire one new skill, what would it be?
Instantly acquire one new skill. Play the piano.
Cool. If you could time travel to any period in history, which era would you visit?
The 50s.
Cool. Okay. And if you weren't doing this, maybe if you weren't doing this and any of the hygienist stuff, what else would you be doing?
I would be on a beach in Hawaii.
It's like beaching it. Okay, that's good. I like it. Yeah, that's good. Okay, so that was a quick fire. Now, looking ahead, where do you see your business in the next 5 years? Like, is there anything that you're excited about or anything that you're just, you can really see on the horizon?
So, I started this career later in life.
Yeah.
I'm hoping to do it for many, many more years because I really don't see it as a job. It's more, it's just so fun and rewarding. My husband does travel quite a bit for work. I would love to travel with him more and be able to do my business via teletherapy, which I'm doing more teletherapy, but just
more of that.
Gaining, more online presence and helping people online. So then it'll enable me to be able to travel with my husband. So but I'm excited for the next 5 years because so much has changed in the field of orofacial myology.
Yeah.
Like I said, so I'm excited to see, as the research is coming in, it's going to be fascinating because it's still such a new field.
Yeah.
People, are not quite understanding what I do, but just slowly getting the word out there. So if we can, if I can just help, one person feel so much better. That's
worth it. Yeah.
Worth it.
Okay. What advice, from one entrepreneur to another, what advice do you have for someone that wants or is starting a new business?
If I'm talking to, a hygienist wanting to get into this, don't give up. It is a challenging field, but don't give up. And, don't have self-doubt, which I tend to have a little self-doubt. Getting out of my comfort zone, like this is, I would never have done this 5 years ago, but, know that self-doubt kills dreams. So be mindful of that. And, I want to mention, I have a dear friend who I went to hygiene school with, and she's now stage 4 cancer, not doing well, started her myofunctional therapy job kind of close to same time I did. And she and I would talk once a week, just kind of bounce off ideas and, encourage each other. And I just remember having this conversation with her because I was like, this is hard. It's hard. You feel so alone sometimes in this field, and then you have social media, and then you're like comparing yourself, like, oh my gosh, look who's doing this and that. And she's like, Michelle, you are a horse on a racetrack and you have blinders on and you just go and you don't look right and you don't look left. You just do you. Yeah. So everyone has their own story. Just be you and know your why. Like, why are you doing this? Right. And everyone has a story, and hopefully you just go for it.
Go for it. Yeah.
So just do it.
Just like Nike, like the words of Nike. Is there anything that I didn't ask you that you were hoping we would talk about?
I feel like, I hope I covered a lot, and I know I probably missed a few things, but if there's any questions, if anyone wants to reach me about myofunctional therapy, I can give you my
share all the socials. Let's do it.
www.myomtofidaho.com. You can email me at michelle@myomtofidaho. And if you do mention this podcast, then I can give you 50% off for your first evaluation appointment.
Oh my gosh. Everyone,
be happy to do that.
Call Michelle. Start breathing the way you're meant to.
Breathe better.
Eating, swallowing, sleeping, just all the things start with.
All the good things.
Is your mouth
get those muscles working.
Blow your nose.
Blow your nose. blow your nose. Get that out. Seriously.
Michelle, I thank you so much for being on the Dean's List.
Well, thank you for having me. And I look forward to seeing you sometime soon.
Yeah, we need to. Okay. Thanks.
Okay.
And thank you all for tuning into this episode of the Dean's List. Be sure to subscribe on your favorite platform to stay updated, and follow us on Instagram at official_Dean's List and YouTube at It's Official Dean's List. I'm your host, Allison Dean. Until next time.